Non-emergency medical transportation, or NEMT, is a highly demanding logistical operation that requires exact vehicle coordination to meet strict healthcare compliance. One operational error creates an immediate chain reaction. If a driver runs late, a patient misses a dialysis appointment. If a document is mishandled, the provider faces a severe HIPAA breach. And if billing codes mismatch, state Medicaid agencies deny thousands of dollars in claims. Most fleets manage these risks using a patchwork of disconnected software, spreadsheets, and physical paper logs. This creates a massive blind spot, isolating the drivers on the road from the dispatchers, the medical facilities, and the patients waiting at home. SwiftAid Transport manages this differently. They use a specialized routing tool called Bambi to schedule rides and feed all that dispatch data directly into Zoho One, a unified ecosystem of over 40 business applications that runs the rest of the operation. When your tools do not communicate, you lose logistical control. A single operating system pulls the data together to eliminate those blind spots. The lifeblood of this data isn't collected in an office. It is generated out on the road, minute by the drivers. To capture this, drivers use the Zoho Expense mobile app. Once granted the necessary permissions, the app uses the phone's GPS to track the vehicle's location continuously in the background. Here is how the background tracking works. Instead of a driver scribbling numbers on a clipboard, the app generates a live trace of the route, autonomously logging the exact start and stop times, the precise odometer readings, and the exact mileage required for policy compliance. The physical vehicles require their own oversight. SwiftAid uses Zoho Creator, a low-code development platform, to build a customized, centralized hub specifically for fleet management. Through this hub, daily vehicle inspections are completely digitized. Staff upload photos and relay inspection statuses instantly, logging the exact wear and tear of a vehicle over time to schedule predictive maintenance before a breakdown happens on the road. By automating driver expense logs and predictive vehicle health in a single dashboard, a fleet transitions from a chaotic liability into a predictable, manageable asset. Tracking vehicles is straightforward, but handling the medical profiles of the passengers inside those vehicles introduces strict federal rules. The baseline legal requirement for using any cloud software in healthcare is a Signed Business Associate Agreement, or BAA. A signed BAA means the platform is eligible to handle patient data, but compliance is a shared responsibility. The software only becomes HIPAA compliant when the provider actively configures the internal safeguards correctly. In this database schema, administrators must mark sensitive patient history as EPHI. Toggling this immediately converts the information into ciphertext, locking the server data with AES 256 encryption. The system then bounces back unauthorized requests, masking the encrypted data and permanently restricting export. Medical facilities require absolute certainty that these patient records remain secure, which means the provider needs a tamper-proof audit trail. To provide that, the software runs real-time audits in the background, logging the exact timestamp, user ID, and IP address for every single login and database modification. When configured correctly, the digital vault locks down patient privacy while offering medical stakeholders complete transparency into who accessed what and when. By integrating the physical data from the fleet engine directly into a secure back-end vault, SwiftAid operates with an exact, real-time view of every moving piece in their organization. This unified cloud architecture scales seamlessly. An operation can expand into a new region or add 50 new vehicles to the fleet without having to procure, test, and integrate a dozen new software subscriptions. As the daily trip volume increases, custom workflows trigger automated email and SMS notifications for required service logs or driver license renewals, clearing administrative bottlenecks before they form. This diagram shows how artificial intelligence processes the raw data. AI assistants analyze these streams of fleet and patient data to spot utilization trends, predicting high demand hours and optimizing future vehicle placement. The core operational philosophy driving SwiftAid Transport is that highly complex technology should do its job and then disappear into the background. By centralizing operations into a single, transparent ecosystem, NEMT providers can stop managing software headaches and focus entirely on delivering safe, reliable care to the patients who need it most.